This is Hayden Scott, EMS Program Manager, EMS University San Antonio. We're now going to look at Lesson 4.8, Behavioral Emergencies. It's always important to remember to remain non-judgmental. When you're caring for a patient in emotional distress, you should always be sure not to make any conclusory or judgmental statements. Um, any kind of statements like that could further hinder your patient care. Your patient's not likely to respond well to comments like that. In order to determine the condition type, you should first rule physical trauma in behavioral emergencies, simply because so many things can present as a behavioral emergency, but you need to do a detailed history and physical to make sure that there are no other underlying factors. Behavioral emergencies, as opposed to psychiatric emergencies, usually involve patients with no diagnosed psychiatric history. Now, this isn't saying that they don't have a psychiatric issue going on, but they just haven't been diagnosed with anything yet, if it is in fact a true behavioral emergency. General factors that may alter a patient's behavior are situational stresses, medical illnesses. A lot of times, if you've got a patient with an elevated temperature, you could uh, notice some pretty severe change in mental status. Psychiatric problems, as I stated before, um, just because they aren't diagnosed with it doesn't mean they don't have a psychiatric issue. Alcohol and drug intoxication or withdrawal. This is going to be one of your biggest factors um, when dealing with these patients. Common causes of behavioral changes: low blood sugar, especially in patients with diabetic history. Lack of O2. Of course, with the lack of O2, you're going to notice inadequate blood flow. Um, is why there is a lack of O2. The brain doesn't function well without blood flow or an O2. Um, Head trauma is a very big cause of behavioral changes. Mind altering substances, not always drugs and alcohol. There are other things that the patient could come in contact with that would cause a behavioral change. Head trauma, I'm sorry, excessive cold and heat, as we discussed in the previous section. Uh, any extremes in the environment could cause behavioral changes as well. General guidelines for managing situational stress reactions. It's always a big thing to act calm. Don't show any uh, anxiety or anything of that nature. The patient will feed off of that. The more calm you are, uh, the more calm your patient will be in the long run. Give your patient time to get control of their emotions. Sometimes they just need a few minutes to take a deep breath. Sit with them, talk to them calmly. Uh, they generally tend to respond pretty well to that. Quietly and carefully evaluate the situation. Always be aware of your surroundings. Talk to the patient. What's been going on lately? Have you been having issues at work? Have you been having issues at home? Um, you know, don't cry too much, though. This could cause your patient to shut down. Know your own emotions and keep them under control. Um, it's very easy in certain situations to blow up, especially when there's any kind of abuse involved, especially involving children. You always have to keep your own emotions under control and keep that non-judgmental front, uh, because if you don't, it could cause a lot of trouble. Uh, you know, it could even put your own life in danger. So you need to be very careful about keeping your emotions under control. Be very honest when explaining things to the patient. Don't hold anything back. Don't sugarcoat anything. Always be honest. Honesty is the best policy. Let the patient know that you're listening to them. Um, yes, ma'am, I understand. Yes, sir, I understand. It's rough. Always be understanding. Repeat back what they say to you. That way, you show that you're paying attention and you're understanding what they're saying. However, you also have to be on the alert for any sudden changes in behavior. Your patient could be talking to you just fine, having a nice conversation, and the next thing you know, they're, you know, irate and they could get physical. So you need to be aware of any signs of a change in behavior. Methods of calming your patient: identify yourself and your role. My name is Hayden Scott. I'm a medic. I'm here to help you. Speak slowly and clearly, but use a calm and reassuring tone. Don't ever talk down to your patient. Um, don't get the quote unquote holier than thou tone to your voice. Um, it's very unbecoming, it's very unprofessional, and it'll turn your patient off very quickly, and you won't get any cooperation from them at all. As I said before, show you're listening to the patient by rephrasing back parts of what they say. Um, you know, I understand you had a rough day at work. I can't, um, why would your boss react like that? Say, rephrase what they say. This shows that you're listening, you're paying attention, and you're comprehending to what they're saying. Don't be judgmental. Show compassion. Um, you're human too. You have emotions. It's okay to show your emotion, but remember, again, you've got to keep it in control. Um, you know, show concern. It's okay. You can show empathy, show sympathy, but not to the point to where the patient can misconstrue it for something else. Use positive body language. Um, you know, put your hands in front of you. Um, don't cross your arms in front of the patient. Don't have your hands on your hips or your hands in your pockets or anything like that. Those could be negative that could be construed as negative body language, and the patient will respond well to it. Acknowledge the patient's feelings. It's okay for them to have emotions, and let them know that. Don't enter the patient's space. Stay about 3 feet away from them. Don't get too close, uh, for their safety and your own. Uh, they may be dealing with something that you haven't caught on to yet. And if you get too close, they could see that as encroachment. Um, they could misjudge it. Uh, they could very easily take a swing at you and knock you out. Keep your space, keep the patient's space, keep your distance, but stay close enough to show that you are there to help them. Again, be alert for changes in the patient's emotional status. Largely, your emergency care for the behavioral patient is supportive. Scene safety and personal safety, however, is always the biggest concern. If at any time you feel that you or your partner's lives are in danger, get out of there. It's okay to involve the family only if it helps the situation. If you notice that the family, nearby family members are only instigating more issues, have them removed from the situation. That's a lot of times you'll have the police department or local law enforcement on scene with you. Have them remove the irritant, because all it's going to do is make things worse for your patient. Um, don't ever threaten to restrain your patient. It will get ugly. Um, they do not respond well to that. Don't ever threaten a patient. Um, if it comes down to them being out of control, let law enforcement take over, if they're available. Otherwise, get out of there. Avoid arguments. Don't argue with your patient. You know, I understand it's okay, but this is what's best. Like I said earlier, have law enforcement on scene. This is for your safety as well as theirs. However, you never want to leave the patient alone. Don't let them, go find something in their bedroom or anything. They, you don't know what they're up to. They could be going back there to take a handful of pills. Um, for the patient's safety and your own, don't ever leave the patient alone. Remember, all suicide threats get transported. At this point, and certain different states have different laws. I know here in Texas, a suicide threat or a suicide attempt, if they don't voluntarily agree to transportation to the emergency department, law enforcement will step in and get a judicial statement stating that they are under what's called an emergency detention, and this gives us as medics jurisdiction to put the patient on our stretcher and take them to the emergency department, even if they don't comply. But again, be aware of your local protocols and your local laws as far as any kind of an emergency detention like that. Your special considerations, you want to look for changes in behavior by your patient. You want to keep your radio on your person just to be safe. Don't ever separate from your partner. For both of y'all's safety, don't separate. You want to watch the body language, gesture, and hand movements of both yourself and your patient. Um, don't take a threatening stance, but also be aware of your patient um, making a threatening gesture or stance. Reasonable force and restraint. The force necessary to keep the patient from injuring themselves or others um, is considered reasonable force. Um, Reasonableness is determined by looking at all the circumstances involved, including the patient's size and strength, the type of abnormal behavior, mental status, and available methods of restraint. Um, this is where knowing your protocols comes into play. Do you have the available to restrain your the available resources to restrain your patient? Always know what you have on your ambulance, and always know your protocols, as well as local laws regarding restraint. In many localities, an EMT may not legally restrain a patient against his will. Um, Make sure restraints used are humane. Avoid handcuffs or flexi cuffs. Um, Follow your protocol. Absolutely. Um, you need to always be mindful of what your local laws and protocols state as far as restraints. Um, the best thing to use are soft point restraints if you have them available. If involved in a restraint, follow these guidelines. Be sure you have adequate help. Employ the fire department, employ the police department. If you, get as many hands as you can um, within reason. Plan the activities. Uh, be sure you go in with a battle plan, if you will, a plan of action. Estimate the range of motion of the patient's arms and legs and stay out of that area until you are ready to move in to restrain the patient. Once the decision to restrain a patient has been made, act quickly. Don't waste any time. Any waste of time could be very crucial. One crew member should talk to and try to reassure the patient during the restraint procedure. If you have 5 people working to restrain this patient, You're just going to confuse them if all five of you are talking to them at the same time. Recruit one person to talk to the patient calmly to reassure them during the procedure. Um, Again, approach with a minimum of four people if possible. The more the better. But again, use uh, you know use reason. Secure all four limbs with restraints as approved by medical direction. Um, again, try to avoid the handcuffs and the flexi-cuffs if at all possible. Most ambulances do have soft point restraints on board. Use them as approved by medical direction. You want to position the patient face up. Do not ever restrain your patient face down for any reason. Um, this is unprofessional. Um, it's poor patient care, and in some states, it's actually against the law. Use multiple straps or other restraints to ensure the patient is adequately restrained. Again, all four limbs. If you have to, use an extra one. If they're bending at the knee, use an extra one just above the knee to help the restraint. The restraint. Um, but again, within reason. If the patient is spitting on rescuers, place a surgical mask on the patient. If he had no difficulty breathing, no likelihood of vomiting, and if local protocols permit. Another thing you can do, put him on some oxygen with a non-rebreather mask. Sometimes it helps calm them down as well. Reassess the patient's distal circulation frequently. If you notice their hands and feet starting to turn purple, you might need to loosen the restraints a little bit. Use sufficient force, but avoid unnecessary force. Don't overdo it. There's no reason that your patient should come away with multiple bruises or what have you. Use reasonable force. If they're given a good fight, yeah, you might have to be a little more forceful with them, but again, within reason. Don't completely overpower them. It's only going to make things worse. Document the reason why the patient was restrained and the methods used. You want to document every move you and any other rescuers made, as well as the patient. Document, 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 because I guarantee you, if it comes up in a court of law and there is just the slightest flaw in your documentation, you could go to jail and lose your patch for unlawful restraint and kidnapping. Uh, don't give anybody any reasonable doubt to question your documentation. Spell it out clearly. Every move. You can never over document anything. Document every second of the restraint procedure, as well as the names and agencies of any rescuers that assisted. Your documentation guidelines. Document your observations in an objective and professional manner. Describe the behavior in exact terms. Don't shortcut it. Don't use slang. Use exact terms. Document the scene thoroughly. What you see, where everything is, where your patient is, how your patient acted, how they responded to rescuers, family members, so on and so forth. Include statements from the patient to support your decision that the patient may have harmed himself or others. Document use or suspicion of intoxicating substances. Record evidence of illness or injuries. Um, Anything that's there before, during, and after any of this process. Document, document, document. That way, if something comes up, they can look at your report and say, oh, this person already had a bruise on their upper arm. They already had knife marks on their forearm. Include the names of law enforcement officers, other members present, and witnesses. As I said before, you cannot over document. Always write down everybody's names. Uh, that way, if something comes into question, they know who else was present and can proceed uh, with any questioning if necessary. This concludes the behavioral emergencies portion. If you have any questions, please contact your instructor of record.